And I had been to so many doctors and they couldn't even figure out what was wrong with me, let alone. Overall, I think much better than when I first came 7 weeks ago. I think in general, I have more good days and good moments than I did before. I think I'm on the right path, yeah. I'm Ileana Hernandez and I traveled from Miami, Florida to be here. And I'm here because I have debilitating symptoms, daily dizziness, daily headaches. My vision gets all weird. I have a lot of, my jaw's always tense and it's hard to chew. It affects my ears. I have ear congestion and sometimes it's ear pain. It goes up to my eyes and then down to my neck, my shoulders, and there's probably other pains like my knees and my hips that are probably also related to my jaw issue. Yeah, and it's chronic and it's really impacting my life significantly. So I'm here hoping that I will be one of Dr. Raman's success cases. Yeah. Symptom that I think is interfering the most at this point is the chronic dizziness. And that's been going on for over a year. And I mean, every single day, there's a certain level of dizziness. It's just a matter of intensity. So some moments or some days are more intense than others. But every single day for more than a year now. And if I don't drive, I haven't driven in a year. Sometimes when it's a little bit mild, I will drive maybe 10 minutes to the grocery store, but I won't venture out farther than that because I'm so scared. It's so uncomfortable and it makes me quite anxious, to be operating, a vehicle while I feel just so off. For the dizziness in particular, I went to the first ENT. He told me, it's really far-fetched that it's related to your jaw. And I'm like, are you sure about that? Because I'm pretty sure that could be a thing. He's like, yeah, not likely. And he's like, well, go see a TMJ specialist. Even though I had already seen a TMJ specialist. And so he was very dismissive. And then I went to a neurologist after that. And then he checked me out. And he's like, I don't know, you've got a lot going on. He literally said, I have no insights to share with you at this moment. And I was in a state of despair and hopelessness because it had been going on for so long already. So for him to say that, oh man, that ride back to my house and that day and for days after that, I was like, nobody's going to be able to help me. Why can't nobody figure out what's going on? And it has to be my jaw, because of all the reading that I had done. But so that was ENT, the first ENT, the first neurologist, they did nothing. I went to another ENT and he took it more seriously and he said, okay, let's do all these tests. I got a CT scan of my brain, a CT scan of my head arteries since I have pounding on this side, CT scan of my temporal bones. I got a balance test and all of that was it was normal. So he said, okay, now that that's normal, I'm more inclined to say it's probably coming from your jaw and your neck. So I went to a physical therapist at that point. He made it worse. It was too intense. And then my dizziness got worse. So then I changed to another physical therapist and he has a different approach. And he does a lot of craniofacial kind of, anyways, it's a different approach and he's been helpful, but it's not dealing with the root cause, right? So then I went to another neurologist and then he said, okay, well, let's treat the headaches. Let's do Botox. And so he did all of these points in the head. Normally the protocol includes, so it was the head, the scalp, and it was, I think, here and here. And then he said that usually they add the jaw. And I said, don't touch my jaw because my physical therapist is like, don't weaken your jaw. And don't touch my neck, because I was told that I have cervical instability, so I need to strengthen my neck. But I did agree to a tiny bit on the traps, I think it is. Yeah. And then, yeah, so because I have a lot of tension, especially here. Like when I turn, I feel it here, right? So that was the Botox, and it did nothing. It did nothing. Actually, I think it's made me feel worse. I don't know if it just kind of got things off balance, and my scalp is now like really sensitive, you know, like when I wash my hair or blow dry my hair. Anyway, so that's been the history in terms of the dizziness. Always, every single day. I have it right now. I would say at least a 7. Yeah, and it can get maybe a 9. That doesn't happen too often, but still at least some days every month. Yeah. Okay, so I've been having a form of headache for at least 20 years, but it wasn't too bad. I was still able to function, you know? And then in 2018, so that was like 5 years ago, I started getting migraines for the first time, ocular migraines, and then it started, and a really bad eye pain. It started causing more impairment. And then I went to a TMJ specialist in Miami, and he put me on an appliance that was not custom made for my mouth. It was massive, and that actually, I forgot to mention that with the dizziness, the appliance actually I think I started seeing some symptoms when I started with the appliance. But I also started to feel some tension, like on the base of my skull. But it wasn't too bad. But then he tried to put me on Invisalign. I did that for only 1 week, and within 2-3 days, I started feeling this like pounding right here. It's not like it's painful. It just feels like it's really uncomfortable, because it just feels like I have this like heartbeat, like my heart is like pounding right here, you know, it's like going side to side. And that makes me feel like I'm on a boat. And I'm like, what is going on? You know, I never had that before. And then the pain on the base of my skull became a daily thing, and it can get pretty bad. It goes up to my forehead, goes here to like the top of my head. It goes to my eyes. If I don't have eye pain, there's at least eye fatigue, you know, or like it just feels like they're so tired and sore. I'm trying to think. I think those are the main headache symptoms. Yeah, it's every single day. I'm feeling it right now. I would say at least like a 7, 8. Third symptom is the visual stuff. That started when I think I became symptomatic with TMJ related issues. It was 5 years ago, yeah, 2018. And it started with ear pain, and my vision just got weird. I'm like, why is it weird sometimes? It was like all of a sudden hard for me to focus or refocus. You know, I would be looking at something, like reading a book, and then I'd look out, and then it would take me like a really long time to refocus my vision, or like looking out, it would kind of feel fuzzy sometimes, but it was sometimes, you know. So I went to an eye doctor, and they're like, you're fine. And then I'm like, but I'm not fine. They gave me some reading glasses, and that didn't do anything, you know. And then I went to another eye doctor recently, an ophthalmologist, and also it was like, yeah, I mean, it's fine, you know. Here, have a new pair of eyeglasses, you know, but it's still there. And it can get to the point where it's so fuzzy that it feels like my brain is foggy, you know, and it's hard for me to concentrate on work. All of my symptoms make it hard for me to concentrate on work, or to have conversations with people, to be on the computer, you know. My head's pounding and I'm feeling dizzy, and then my vision's all weird. It's really hard for me to do my work, you know, especially on the computer, which a lot of my job is on the computer. And it just feels like I'm so off and not present, and almost like I'm kind of not fully in my body. I don't, it's hard to explain, but yeah, the vision stuff is also affecting me. I would say that at least a 6. So for the last decade, I have been working for a state university in Florida, and I am what they call a faculty and educational developer. So basically, we provide professional development for faculty so that we can improve the quality of education at our university. And so that can in turn have an impact on student learning and student success. My background is actually, I have a doctorate in psychology, and I use a lot of psychology in my work. And I also adjunct, I'm an adjunct faculty for the psychology department of the university. So anyways, that's people. You know, people. And it's to the point where I will be very hesitant to schedule a meeting because I'm like, how bad are my symptoms going to be that day? I have to think about things that I never had to think about before. Even my symptoms can be worsened depending on my menstrual cycle. You know, everything is just aggravated. And I'm like, my work calendar is like, definitely skip these days, you know, don't schedule meetings on these days. And so this is just kind of taken over my life, you know, and it's affected not just my work relationships, but my relationships outside of work too, you know. It's really hard just in general to have a conversation with someone and be fully present because I just feel so bizarre. Yeah. So, I feel tension every single day in my jaw. It's like here, and it's on both sides. And when I touch it, more so on this side, it just feels like hard, you know? Some days or some moments in the day more than others, but there's always some tension here. It started 5 years ago, 2018. Interestingly, there were other symptoms that came before the actual jaw pain. So it was hard for me to make the connection initially. So it started 5 years ago, and I saw at that point, I went to urgent care once because of my ears, because I thought like there's something wrong with my ears, you know. Urgent care was like, well, you're a little bit congested, gave me steroids and didn't do anything. I went to an ENT. He said, your ears are fine, but he was very wise, and he said, can you open and close your mouth? And he touched here. And he said, does this hurt? Is this tender? And I said, actually it is. And at that point, I didn't actually have jaw pain. And then he's like, you know, maybe you're clenching or grinding your teeth. I would suggest you see your dentist. So, and then I did a little bit of like research, talked to my best friend. My best friend has TMJ disorder, and she said, maybe you have TMJ disorder like me. And I'm like, I don't even know what that is. So I went to Dr. Google, you know, and then I saw the symptoms, and I'm like, oh crap, I have TMJ disorder, I think. Dentist confirmed it. He gave me like a mouth guard. I did nothing. And then after it did nothing, I wore it for like at least 6 months. And at first it was really bad, and I was bedridden. I didn't work for like at least a few weeks. I was in a lot of pain. And because then eventually the jaw pain got started, and when it started, it was bad. And so I went to the dentist, who then said, go to the orthodontist. And then the orthodontist was like, oh, what's going on is that you have like a bite problem. So you have an overbite, which I do have an overbite. And so I got braces on the back of my teeth. And that helped a little bit. It did not fix the root cause. Then I got the braces removed, and then I went to a TMJ specialist. I'm saying this because I had a very bad experience. So I went to a TMJ specialist, and he got the braces removed, and he said, well, we'll put you on an appliance that is going to move your bottom jaw forward to be parallel with the top. It wasn't custom made to my mouth. It was massive, and it was hard to sleep, and it actually made things worse. Then I actually hadn't felt ear pain or fullness in years. It came back, and that's when I started feeling some dizziness. And I'd never had before this the pain on the base of my neck. So that made it worse. And then when I was already and it significantly worsened my overbite, to the point where now when I go to bed, I have to wear a little piece of tape on my mouth just in case I end up on my back, so that I don't mouth breathe. So that didn't help. It actually made things worse. But what made things even worse is that he put me on Invisalign, even though I was already in a very fragile, vulnerable state, and I was already in a lot of pain. He said, okay, well, let's try Invisalign. And then just a few days in, things got really bad. And that's when I started with the pounding on the side of the head, feeling like I was on a boat. And that hasn't gone away. I only wore Invisalign for a week, even though he was like, just keep using it, just keep using it. I'm like, I feel really bad. I ended up going to the hospital because I'm like, did I have a stroke or something? Like, why do I feel so bad? I haven't been able to recover. And so I'm here. Well, it's like you don't know what you don't know, right? And at that moment, everything was so new to me that I thought he was being helpful because because I have a colleague who also was getting migraines because of his jaw, and it took him 2 years of going from doctor to doctor to realize that was a problem. Yeah, I would say with symptoms like mine, I would say, recommend that they go fix the root cause, which is, a jaw problem. And most dentists, unfortunately, they don't have the adequate training and skills to be able to adequately treat the condition. Because I went to a TMJ specialist. So even if that's the thing, it's that even if they say that they're TMJ specialists, no. I feel like I'm doing much better. I would say about overall, combining all the symptoms, about 40% improved. So dizziness, just the overall frequency, intensity, and duration of my symptoms. The main ones are dizziness, tension headaches, and those two are related. Like, I can feel pulsating on especially this side, and it does make me feel like dizzy, like I'm kind of like on a boat. I would say about at least 40% with the dizziness. Yeah, so I'll know the dizziness is better because it used to be pretty bad when I was working. I started standing up, to work instead of sitting down because I would feel more dizzy when I was sitting down. And now I've actually been able to work sitting down again. And I'm in a meeting, I'm in a Zoom meeting, and I'm not totally distracted because I'm feeling so dizzy, or along with that was visual disturbance, and I don't know if that's later. Well, that's later. Okay, so let me put a pin on that. So, and I'll be walking my dog and I won't feel so dizzy as well, so I would say about 40% reduction at least. Headaches, tension headaches. So mainly it's like here, but also I would get a lot of pain on the pressure on the base of my skull, and I would also feel a lot on my forehead. I haven't felt anything on my forehead for, I would say, at least a week, if not longer. And I would say about the same on my neck. Maybe I'll feel like sometimes like a little bit of discomfort where it's like, oh, it's still a little there, but pain, I have not felt. This is a little bit more persistent. Like I feel it right now. But also we were doing a bunch of things and opening my jaw and closing and moving my neck. I would say the headache's at least 40% as well. Yeah. And then, that one got much better pretty early on. Like shockingly, like I felt a difference maybe day 2. And that is, I would say at least 60% better. Yeah. And then fourth, it would be jaw. Like every day there would be tension on my jaw, more so this side, but always, every day at some point, if I would go like this, I would feel it really tense. And when I would eat, there would be some discomfort. And that's also at least, it's much better. I would say that when I touch, more often than not, I don't feel it's like tight and it feels like, I don't know if this gets swollen. Is that a thing? Okay. But it just felt like there was like not a ball, but just like right here especially. And I don't feel that as often anymore. again, it's tricky like we were talking about before, but I would say at least 20%. Yeah. And then there were other things like neck and shoulder pain, you know, that's gotten like a lot better. I would say at least 40% better. When I touched before, I would touch my shoulders and it would feel like I was wearing shoulder pads, you know? And now I touch and it feels a lot better. And I would touch here and it was always like, it felt swollen and tight, like the SEM area. And I don't feel much of anything, honestly. Overall, I think much better than when I first came 7 weeks ago. Dizziness, I can still feel dizzy. To me, it seems to be connected to this pulsating that I have on the left side. So when it feels more intense, it just kind of feels like I'm like on a boat. And so the dizziness, I would say, has improved, definitely. 60% that I said initially, yeah. Headache, again, under headaches, I include this, which is still very persistent. But I used to have really bad pain in the base of my skull, and that has gone away. I can still feel pressure sometimes, but that's still much better than like pain. Category of headache, I would still say, improved maybe 40%, but I have a feeling that I said 60%. Visual symptoms have improved at least 50%, I would say, yeah. Job related, I would say maybe like 40%. I was in a pretty good place with physical therapy by the time I got here, so, but it does feel like I'm a lot less, it feels like the tension has reduced. I'm able to eat things that I wasn't able to eat before, and I'm actually gaining weight. Because, yes, for me, it's a very good thing. Yeah. Yeah, I would say at least 40%. Yeah. Yeah, neck pain. So when I first started, for years, my SEM, you know, was like, you know, and I would feel, and it was so, just felt like there was tension and swelling, and neck pain for me was a very, very common thing. And now, honestly, I feel maybe a little bit sometimes, but it seems to have like calmed down, you know? So I would say that has improved at least maybe 70%, I would say. And the shoulders, it used to feel like I was always wearing shoulder pads, you know, I was like stuck in the 80s wearing shoulder pads. And now, you know, like I touch right now and I barely, you know, I don't feel that anymore. So that also I think has improved at least 70%, yeah. The reflex started getting better when I put this in, and now I'm able to do things that I couldn't do before, like lay down on the couch when I'm winding down for bed. Before I would have to use a wedge pillow because it would go up. So I think that is improved. I mean, I still have reflux, but I think it has improved maybe like 40%. All right, well, I think in general, I have more good days and good moments than I did before. So the jaw pain that I came in with and like just a lot of tightness, I would say that's like 70-80% better. I had hand pain before I got the orthotic in, and that has ceased to exist completely, like 100% better. I used to always get it like when I would wake up in the morning. And then neck and shoulder pain, I think, is about 70% better, with help, you know, also of the physical therapy. And the headaches and the dizziness, could be a bit persistent, but I feel it less intense and less frequent. I do still feel it every day to a certain extent, but there's more time that I'm like, oh, you know, like I'm like working and I like, it's not prevalent, or it's not so intense that I'm thinking about it. So there are more of those moments. I would say at 50%. Yes, so my vision can get blurry, and I mean, that's the main symptom, like my vision can get blurry. So that's gotten better. That percentage would be about, I would say 70%, I think. I did. I had pain behind the eyes, and I think that's like 95% better. I barely feel it. Okay, so I was skeptical because I had tried so many things and I had been to so many doctors, and they couldn't even figure out what was wrong with me, let alone what the treatment would be, you know? So I came in and I was like, well, maybe this is going to be another one of those situations, and is the investment going to be worth it? But the videos did help, you know, all of the stories. Then at some point I was like, okay, this is going to be awesome, and this is going to be like, I'm going to feel like it's going to be gone. Like I'm going to be one of those stories, and I'm not one of those stories, you know. I mean, I'm still symptomatic like every day, you know, but and I'm still hopeful that I'm going to continue the path with like physical therapy and different things, you know, to get better and better. I'm grateful that I'm like, I would say overall like maybe 60% better than when I came in. And so I'm driving again, which I didn't before. I'm not driving too much, but I'm driving, you know, I'm driving on the highway. You know, Miami traffic is insane, you know, so I was avoiding driving on the highway during the weekday, you know, because what if I get dizzy? And now I drive and I'm like, I feel fine while I'm driving. Actually, I feel sometimes better when I'm driving than when I'm like walking around my house, you know, so
give you freedom.
Yes, I was just going to say that. So it's this little by little, I'm getting more and more freedom, you know, and that's just really important for me, just psychologically, you know, emotionally, mentally. And so, so I think I'm on the right path. Yeah.